Namaste, I am Dr. Sonali Gautam. I am a consultant gastroenterologist and hepatologist at Airoli Center for Dietitian. Today, I am going to discuss about fatty liver. Fatty liver is a very vast topic. So, first of all, we have to understand what is fatty liver. So, whenever the fat in the liver is more than 10%, then it is called fatty liver. There are three grades: grade 1, grade 2, grade 3, which is the more the grade, more is the fat and more is the damage to the liver. Fatty liver can happen in both ways, through alcohol or through non-alcohol, because all the alcohol is carbohydrate, which is ultimately converted into fat by the liver, and it gives rise to fatty liver. So right now, today I'm not going to discuss about alcoholic fatty liver. Today I'm going to discuss about non-alcoholic fatty liver, means patients who have no history of alcohol, still they have fatty liver. So how does this happen? There is a large syndrome called metabolic syndrome. So any patients who have a history of diabetes, who are obese, who have blood pressure, and who have very less physical activity, these patients are known to have a metabolic syndrome, and these patients have higher level of fat in the body and thus have fat in the liver, and this is called non-alcoholic fatty liver disease, because all the glucose we eat is ultimately converted into fat by the liver and it results in fatty liver. So what are the symptoms? So basically there are no symptoms. Usually we go ahead for a sonography for some abdominal pain and we see that we have found a fatty liver. But nothing to be worried about, because fatty liver grade 1 and grade 2 is usually manageable, and grade 3 has to be managed under the guidance of your doctor. So first of all, whenever you have fatty liver, you have to check your liver function test. If your liver function test is elevated, your doctor will advise you one medicine to reduce the inflammation. But there is no such medicine to reduce the fat from your liver. So how will we manage the fatty liver? So there are very few treatment available, which is one Saroglitazar, but more than that we have to understand that it is a part of metabolic syndrome. So we have to regularly exercise, 40 minutes of daily brisk walk. We have to reduce the waist hip ratio. More is the waist, more is the fatty liver. Calorie deficit. Daily you have to reduce the amount of calories which have been giving you this fatty liver, and completely avoid processed food. All bread, pav, biscuit, khari, toast, farsan, aerated drinks, anything which comes in packaged form should be cut down. So lesser these processed food, lesser is the sugar in your body and lesser is the fat conversion. And these are the basic method of management in both prevention and treatment for a non-alcoholic fatty liver disease. If you want to know more about non-alcoholic fatty liver disease, kindly contact us on the number given below.